Good morning. I would like to call this meeting of the House Children and Youth Committee to order. Reminder that this is being broadcasted. Please silence your phones, and also, members, please use the microphone when you are speaking. Today we'll be voting on two resolutions, House Resolution 149 and House Resolution 181. Both are sponsored by Representative Curry. As you may know, the years from birth to 5 are the most critical for a child's development, laying the foundation for their future health and overall well-being. Today we will vote on two resolutions designed to strengthen support for Black mothers and babies during these vital early years. Our committee remains dedicated to advancing meaningful legislation that ensures the safety and well-being of children. To get started, Brooke, would you take the roll?
Chair McNeil,
Here.
Representatives Bellman,
Designation.
Boyd,
Designation.
Serrato,
Here.
Curry,
Here.
Fleming,
Here.
Genst,
Here.
Haimbidge,
Designation.
Howard,
Designation.
Kazim,
Designation.
Krajewski,
Designation.
McAndrew,
Designation.
Nelson, Parker,
Designation.
Chair Klunk,
Here.
Representatives Barger,
Designation.
Day,
Designation.
Flick,
Here.
Hogan,
Designation.
Kozak, McKenzie,
Here.
Mihalik,
Designation.
Pugh,
Here.
Schlegel,
Here.
Walsh,
Designation.
Zimmerman.
Designation.
You have a quorum.
Thank you, Brooke. Our first resolution for consideration is House Resolution 149, sponsored by Representative Curry. Is there a motion to consider House Resolution 149? Thank you, Representative Genst. Is there a second? Thank you, Representative Nelson. Danielle, please provide a summary of the resolution.
Good morning. House Resolution 149, sponsored by Representative Curry, designates April 11th, 2025 as Black Doula Day in Pennsylvania to acknowledge the work of Black doulas to improve the physiological, social, emotional, and psychological health of women, newborns, and families during pregnancy, birth, and in the postpartum period. The following third-party interest groups support this legislation: the Hospital and Health System Association of Pennsylvania and the Pennsylvania affiliate of the American College of Nurse Midwives. There is no known opposition.
Thank you, Danielle. Representative Curry is here to speak on the resolution. You may.
Good morning.
Good morning.
Thank you for considering this resolution today as we're coming upon Black Maternal Health Week, which starts on the 11th. I just want to give you all a little bit of background today about why this day is so important. When I think about all the grassroots work that is being done throughout the Commonwealth, I just want to give you all a little bit of background, if I may, Chair. Good morning, everyone. Today, I am proud to speak about an important and long overdue recognition, Resolution 149, which designates April 11th, 2025 as Black Doula Day. This day serves to honor the crucial role of Black doulas play in improving maternal health outcomes. Black doulas are at the forefront of reducing maternal health disparities, especially in communities that face the most significant challenges in our healthcare system. Their work is often unrecognized, yet it is vital in bridging the gaps that have too long existed in maternal care. Supporting Black doulas creates a more inclusive and diverse healthcare environment, one where the quality of care and patient experience can be significantly improved. By celebrating Black Doula Day alongside Black Maternal Health Week, we highlight the pressing need for awareness and action around the inequities Black women face in the maternal health system. Doulas provide continuous physical emotional, and informational support throughout labor and delivery and beyond. This support not only leads to better birth outcomes, fewer interventions, and higher satisfaction, but also builds trust, something that is often lacking in healthcare systems, especially for Black mothers. When a Black mother sees someone who looks like her advocating for her, it fosters a sense of comfort and emotional security in a system that has historically failed her. In the United States, Black doulas make up only roughly 10% of the total doula workforce. That statistic is not just a number, it's a glaring reminder of how much work remains to be done. In Allegheny County, Black women experience pregnancy-related deaths at 3 times the rate of white women. This stark reality underscores the need for culturally competent care and the critical role of community-based support. Resolution 149 is more than just recognition. It's a step towards inclusivity and equity in healthcare. By acknowledging Black Doula Day, Pennsylvania affirms that every mother, regardless of race, deserves access to the best care, which includes the invaluable support of doulas. It sends a powerful message that diverse voices and care providers are essential for the health of all communities, particularly those that have been historically underserved. By passing this resolution today, Pennsylvania is making a commitment to ensuring that maternal health is inclusive, equitable, and supportive, especially for Black families. Thank you.
Thank you, Representative Curry. Is there a motion to consider House Resolution 149? Thank you, Representative Serrato. Is there a second? Thank you, Representative Against. Chair Clunk, would you like to give any comments?
Thank you, Madam Chair. I move that H.R. 149 be reported from committee with a recommendation to re-refer the bill to the Health Committee. We are bypassing a deliberative process that we have here by not putting bills and resolutions in the appropriate committee, as this particular resolution deals with healthcare issues. And the Health Committee has a meeting tomorrow, so this resolution could be easily added to their voting agenda. So I make that motion today. Thank you.
Thank you, Chair Clunk. There is a motion before us to refer House Resolution 149 to the House Health Committee. My members, I am encouraging a no vote on this motion. Brooke, please take the roll. Oh, I'm sorry. I need a second. Rep. Serrato? Thank you.
Chair McNeil,
No.
Representatives Bellman,
Designation.
Boyd,
Designation. No. Oh, designation, no.
Serrato,
No.
Curry, Fleming, Genst, Haimbidge,
Designation, no.
Howard,
Designation, no.
Kazim,
Designation, no.
Krajewski,
Designation, no.
McAndrew,
Designation, no.
Nelson, Parker,
Designation, no.
Chair Clunk,
Yes.
Representatives Barger,
Designation, yes.
Day,
Designation, yes.
Flick, Hogan,
Designation, yes.
Kozak,
We have his designation now, so designation, yes.
McKenzie, Mahalik,
Designation, yes.
Pugh, Schlegel, Walsh,
Designation, yes.
Zimmerman.
Designation, yes.
With a vote of 14 to 12, the motion to refer H.R. 149 to the Health Committee fails. Is there a motion to adopt the resolution? Representative Serrato? Is there a second? Representative Nelson? With no further discussion, Brooke, please call the roll.
Chair McNeil,
Yes.
Representatives Bellman,
Designation, yes.
Boyd,
Designation, yes.
Serrato,
Yes.
Curry, Fleming,
Designation, yes.
Genst, Haimbidge,
Designation, yes.
Howard,
Designation, yes.
Kazim,
Designation, yes.
Krajewski, McAndrew,
Designation, yes.
Nelson, Parker,
Designation, yes.
Chair Klunk,
No.
Representative Sparger,
Designation, no.
Day,
Designation, no.
Flick,
Yes.
Hogan,
Designation, no.
Kozak,
Designation, no.
McKenzie. No. Mahalik,
Designation, no.
Pugh. Schlegel. Walsh,
Designation, no.
Zimmerman.
Designation, no.
The resolution passes 15 to 12 and is reported as committee from the House Children and Youth Committee. The second resolution for consideration is House Resolution 181, sponsored by Representative Curry. Is there a motion to consider House Resolution 181? Thank you, Representative Nelson. Thank you. Is there a second? Thank you, Representative Serrato. I also like to make note that Representative Krajewski is here. Danielle, please provide a summary of the resolution.
House Resolution 181, sponsored by Representative Curry, designates the week of April 11th through the 17th, 2025, as Black Maternal Health Week in Pennsylvania to promote awareness of the maternal health crisis and the importance of reducing maternal mortality and morbidity among Black women. The following third-party interest groups support this legislation: the Hospital and Health System Association of Pennsylvania and the Pennsylvania affiliate of the American College of Nurse Midwives. There is no known opposition.
Thank you, Danielle. Representative Curry, sponsor of Resolution 181, would you like to provide remarks?
Yes, thank you, Chairwoman.
Thank you.
Today I stand before you to highlight an important initiative, Resolution 181, which recognizes the week of April 11th to 17th as Black Maternal Health Week. This resolution addresses a critical issue: the disproportionate rates of maternal mortality among Black women. Black women are 2 to 3 times more likely to die from pregnancy-related causes in Pennsylvania than other women, a staggering statistic that places the U.S. among the highest in maternal mortality rates compared to other developed countries. What's even more alarming is that 93% of these deaths are preventable. That means there is an urgent need for early intervention, better education, and more importantly, improved health care. Black Maternal Health Week serves as a call to action, creating spaces for these conversations and raising awareness. I am excited that we here in the Pennsylvania House have the PA Black Maternal Health Caucus, where we will be taking this year's Black Maternal Health Week to Pittsburgh from April 14th to April 16th. We are excited because of these very disparities that I have just explained. Additionally, the disparity between urban and rural areas in maternal health is a significant concern, with rural communities facing even higher risk. To date, this resolution has already been passed in states such as California, New York, Virginia, North Carolina, South Carolina, Delaware, and Michigan, amplifying the conversation about the urgent need for change. This resolution is a step, a big step, in investing in community-driven policies, research, and most importantly, quality care for Black mothers, who are the largest demographic who are dying. It is time we come together to ensure that every mother, regardless of their race or where they live, receives the care they deserve. Thank you.
Thank you. Is there a motion to adopt House Resolution 181? Thank you, Rep. Serrato. Is there a second? Thank Rep. Krajewski, sorry. Is there any discussion on House Resolution 181? Thank you, Chair Klunk.
Thank you, Madam Chair. I make a motion to move H.R. 181 that it be reported from committee with a recommendation to re-refer the bill to the Health Committee. Again, we believe that we are bypassing the deliberative process by not putting bills and resolutions in the appropriate committee, since this is a very important healthcare issue that we need to address here in Pennsylvania and throughout our country. So as with the prior resolution, the Health Committee does have a meeting tomorrow, and this resolution could easily be added to their voting agenda, where I believe that it would be the most appropriate, and I appreciate the maker for the resolution. But I do make that motion. Thank you.
Thank you. There's a motion before us to re-refer H.R. 181 to the House Health Committee. My members, I am encouraging a no vote on this motion. Brooke, please take the roll call. Oh, I'm sorry, I need a second. Second, Rep. Curry. Thank you. Brooke?
Chair McNeil,
No.
Representatives Bellman,
Designation, no.
Boyd,
Designation, no.
Serrato,
No.
Curry, Fleming,
Designation, no.
Genst, Hainbidge,
Designation, no.
Howard,
Designation, no.
Kazim,
Designation, no.
Krajewski, McAndrew,
Designation, no.
Nelson, Parker,
Rep. Parker is now online, and designation, no.
Chair Klunk,
Yes.
Representatives Barger,
Designation, yes.
Day,
Designation, yes.
Flick, Hogan,
Designation, yes.
Kozak,
Designation, yes.
McKenzie, Mahalik,
Designation, yes.
Peel, Schlegel, Walsh,
Designation, yes.
Zimmerman.
Designation, yes.
With a vote of 14 to 12, the motion to re-refer H.R. 181 to the House Health Committee fails. Is there a motion to adopt the resolution? Rep. Serrato, thank you. Is there a second? Rep. Nelson, thank you. With no further discussion, I'm going to ask Brooke to take the roll.
Chair McNeil,
Yes.
Representatives Bellman,
Designation, yes.
Boyd,
Designation, yes.
Serrato,
Yes.
Curry, Fleming,
Designation, yes.
Genst, Hainbidge,
Designation, yes.
Howard,
Designation, yes.
Kazim,
Designation, yes.
Krajewski, McAndrew,
Designation, yes.
Nelson, Parker,
Designation, yes, online.
Chair Klunk,
No.
Representatives Barger,
Designation, no.
Day,
Designation, no.
Flick, Hogan,
Designation, yes.
Kozak,
Designation, no.
McKenzie, Mahalik,
Designation, no.
Peel, Schlegel, Walsh,
Designation, no.
Zimmerman.
Designation, no.
The resolution passes 16 to 10. House Resolution 181 is reported as committed from the House Children and Youth Committee. With no further business, is there a motion to adjourn the meeting? Representative Nelson, is there a second? Representative Against. Thank you. We stand adjourned.